Hello, everyone, and welcome to In Time. My name is Nicholas Lamar Soutter. I will say I have reason to suspect that we're going to have a little lag. If we do, please ignore it, and uh, let me know. Someone in the live chat will no doubt say anything. Um, uh, it's amazing how many of recent streams have been difficult to know quite where to begin. I want to start with a very brief discussion on what it means to be a hero. We talk about heroes a lot, and heroes get weaponized. They get politicized. They are marvelous tools for politics. If you have a war hero, bring them with you to when you're doing your State of the Union or any other activity. And I understand it. I do get it. We've had a number of heroes in this country. Neil Armstrong was a hero, irrefutably. Anybody associated with he gets the credit, but frankly, anybody associated with the life and death parts of everyone in the Apollo capsule, which burned the astronauts alive, they were heroes. They were all risking their lives to further not just the causes of the United States, but the causes of the human race. And we are facing another discussion on what it means to be a hero. And for the first time in quite some time, the heroes aren't people on the battlefield, of which we've had a number. They're not even firemen and police officers, although we've had a number of important heroes along those lines. I'll start with the first that everybody knows. It's the people in the medical communities who are putting their lives at risk to save others and who have been constantly doing so. I'm not saying anything that anyone doesn't know when I say that they're heroes. And if you've tuned in time to hear me say the same platitudes, it's more than a platitude, but it becomes a platitude after a while. We thank you for your service. It's too easy to say these things. But if you come to hear the same platitudes you can hear anywhere else, rest assured we're not going to end there, because I have to say this: how do you honor a hero? And when we take a look at the number of nurses, doctors, and other medical workers who are not only contracting this and dying, but who are committing suicide, started in Italy, but it's hit in the U.S., where we have now a number of doctors who have contracted it. Some usually, the biggest case actually is they contract it and then they realize that maybe they've infected a whole bunch of other patients. But obviously overworked, obviously distraught. These are our heroes. So if you think about what we can do to honor these heroes, people have suggested honk if, you see a sign, honk to celebrate our nurses and doctors. That's fine. That's good. I'm for that. Ribbons, great idea. Donations, not a bad idea. One hospital in New York actually just gave their entire staff, I think it was 1 week's vacation. Okay. If you were to ask most of them what they want to honor their work, I think they would want the rest of us to do what we can to fight alongside them. Now, I don't have many skills that I can bring to the table there. There is one thing I can do. There is one thing I can do to fight alongside our heroes. I can stay home. That's what I can do. That's what you can do. Doesn't sound like a lot. I have 2 kids. Trust me. It's a bit of a sacrifice. It's not the same thing. I don't want to say that I'm on par with a nurse or a doctor. I'm not, obviously. That's ludicrous. I'm not trying to suggest that. What I am trying to suggest is if I honor the sacrifice of these people, then maybe I can do my part, and that means sacrificing the fact that I can't get the groceries I want all the time. That means not getting into fights with people. That means not putting a larger burden on the healthcare system. That means not going out and getting infected and or possibly passing it. That means wearing a goddamn mask if I do have to go out. That's what it means. That's what modern American heroes are asking of their fellow countrymen. Go out and talk to a nurse or doctor. Tell me I'm wrong. That's what they're asking. And people who say that these doctors and nurses are heroes, how many of them are going out and doing the exact opposite of what they would want, what they would advise? Not just because they don't want other people getting sick or dying, but because those sick and dying are brought to their door, endanger them and endanger their families. Believe it or not, a lot of them have kids too. You want to honor a hero. Take some sacrifice yourself. Stay home. And if your state opens up and they say you can now go to the grocery store with everyone else and you can go out and have a grand old time, go to a park, ignore it. Stay home. I wish I could tell you we are at the end of this. At one point I did say, in fact, that we were nearing closer to the end than to the beginning. I was ambivalent about saying that. That was on the assumption that things would continue as they were, and that we would continue on lockdown. That hasn't happened. As Dr. Cy Gart, who was on this channel twice now, but the one I'm talking about is on Tuesday. As he said on Tuesday when we were talking about coronavirus myths, it's not actually that we're going to get a second wave. I'm going to refer to it as a second wave. It's easier to think of as a second wave. The first wave wasn't stopped. We didn't finish the first wave. And we're going to get hit again. Former CDC Director Tom Frieden testified before Congress and said that at this rate he was pretty sure that we hadn't even begun to see the worst of it. Let that sink in. We haven't begun to see the worst of it. He said this could continue for 2 years. Now, before you get extraordinarily despondent about that, there is some good news in with that grim figure. He's not talking about all of us being locked down for 2 years, but this virus isn't going to go away any more than the flu has. But it's going to take 2 years for roughly 70% of the population to have had it at least once, and to give essentially herd immunity to those who haven't. 2 years. And until that happens, people are going to get it. Now, as long as the hospitals are okay, and as long as we don't have so many people getting it so quickly that our infrastructure can't be maintained, it's really not a huge deal. It depends on what the final numbers are on the mortality rate for this. The lowest numbers, there's actually a set of numbers that came out not that long ago that said it's actually only a 1.2% mortality rate. That's not bad. That's not bad. The CDC, I think last I checked, was still sticking around 3.7% mortality rate. That's pretty bad. And I've seen figures as high as 7%. I've seen figures higher. They're not credible in my view, but the highest ones that could be sort of credibly argued thus far that I've seen are about 7%. And it's hard to tell because we're learning recently that children in New York in particular have been coming down with a number of rashes and very bizarre symptoms that are clearly COVID related and previously hadn't been. Some of these have been lethal, clotting among them, strokes, pulmonary embolisms. So we know that there's a lot of unknowns. Sorry, I think that was poorly phrased. We know that the number is going to be somewhere probably in that range. We don't know yet. It's almost impossible to tell. One problem is if you take a look at, for example, in the United States, the number of people who have gotten it in the confirmed cases, what's the mortality rate there? It's actually in the U.S. about 12%. Okay, that's huge. That's big. But those are of confirmed tested people who've had it. There are a lot of people who either haven't been tested or who had symptoms so mild nobody bothered to test them. So it's probably almost certainly going to be lower than that number, but we just don't know. We also don't know what's going to happen with drugs like remdesivir, which is showing some immense promise right now. And it's not going to stop you from getting it, but if it's administered early, it seems to have some pretty strong efficacy in helping. We don't know for certain yet, but I think there's reason for cautious optimism there. but we don't know. We've got no idea. So about the best you can do, especially since nobody's been stockpiling remdesivir, nobody anticipated this. We don't have huge quantities of that drug. The best thing you can do is stay home. And there are people wearing masks, and when asked why they're wearing masks, oh, well, because I'm not scared. That's not why you wear the mask. The mask isn't to protect you from anything. It actually does help a bit, not much, but it helps. The mask is to protect other people, because even just exhaling and breathing on somebody, you can infect them. And if you cough, that can go as far as 6 feet and infect someone 6 feet away, or hit a surface. So you think you didn't infect anyone, but you're at the post office. Oh, ooh, you coughed. Poof. You hit a table, something. Somebody there touches that table. It's on their hand. They touch their face. That's how the infection spreads. It is what is called a logarithmic. It is a logarithmic infection rate. What does that mean? That means the rate of infection, or the rate of people who are infected and or who die, doubles every 3 days. If you want to get an idea of that, there's an old parable of a man who said that he wanted to be paid for work, a Middle Eastern parable. He had wanted to be paid for work by putting 1 grain of wheat on a chessboard, and then 2 grains on the next square on the board, 4 grains on the next, 8 on the next, 16 on the next, and so on and so on and so forth. And what it turns out is that by the time you get to the final piece or the final square on a chessboard, you would have enough wheat to bury half of the state of Missouri. That's a lot of wheat. That is what a logarithmic progression does. It doesn't seem like a lot, but it grows quickly. Right now, there are a number of different projections as to how many deaths we're going to be looking at. We're currently looking at, if I recall, I think of 1.6 thousand deaths, 1,600 deaths yesterday from COVID in the U.S. alone. 1,600 deaths in the U.S. from COVID alone. Some estimates say it's going to be at about 2,000. Others have gone as high as 3,000 a day, starting or reaching that number at about January 1st. Now, we haven't been seeing that kind of logarithmic growth, and the reason is because of social distancing. Our president has decided that he is going to abandon most of those social distancing measures. I think it's a false choice, the choice between an economy and social distancing. The reality is there are ways to do it and do it reasonably safely, and there are ways to change our economy to be able to work within the confines of even a stay-at-home economy. It's not easy to do. Nobody wants to do it. We've done it before. It was called World War II. We completely revamped our economy. Most of the workforce gone over to Germany or to Japan. Just gone. All of a sudden, women who were used to working, staying at home and taking care of the family at home, all of a sudden they're out working. Completely changed all of the U.S. economy and how we think about work. Just turned it on its head. We can't do that again? This greatest country in the world? Kawesa for 5,000 won. Thank you very much for the super chat. We are monetized. Anyone who wants to send a super chat, we do sincerely appreciate it. The mask isn't for you. It's to protect the people you care about. Bruce Wayne, The Dark Knight Rises. Okay, good. Well done. I like that one. I like that. Thank you very much, Kawesa, a very good friend of the show who we sincerely appreciate. So thank you for that super chat. Very apropos and bonus points for a Dark Knight reference, so thank you. So the head of the CDC, former head of the CDC, says we're likely going to see things get much worse. Current head of the CDC has said that. Head of the infectious diseases has said that. We've had the World Health Organization. This is not guesswork. The agreement is almost universal, except at the White House, except for the president himself. Everyone else, I mean, Fauci can be seen literally laughing into his hand when the president starts talking about what's what his plans are to do it. Once again, I'm sorry I have to say this. Please do not freebase Lysol and or inject bleach. And we do have a question here about symptomatic or asymptomatic. In Massachusetts, at least, they're only testing symptomatic people and saving most of it for medical workers. If you're sick, it looks like you might have it. They test you. If you don't have it, you go back to work. And the reason is we don't have enough healthcare workers. So we just don't have the testing abilities. Barack Obama came out and said in a private phone call to donors and political operatives for the DNC that he thought the White House had completely bungled and just made a complete mess out of this. And I don't think there's any disagreeing with him. I think we'll get to it. To give you some ideas so we can put all of this in context. And I mean, right now, we have 10,000 healthcare workers in the United States that are infected, 10,000 meat packing workers who are infected, such that the union is saying they want to close down the plants and keep them closed. The United States has lost 25% of its beef production capacity. You can still find beef, but it's getting much harder to find. 40% of the pork processing capacity has been eliminated in the U.S. And it's going to stay that way until the workers get back to work, and whether or not they can or will is depending on a large number of factors that nobody understands yet. There is also a recall process starting for the mayor of Las Vegas, who almost appeared to be high when she went on CNN and suggested that Vegas should reopen for any number of reasons, and that she's talking casinos and bringing people into close proximity, shows the whole. That's a crazy interview. If you want to see something really crazy, go watch her on CNN talking to Anderson Cooper. It's hard to shock Anderson Cooper. She did it. Speaking of Las Vegas, as a segue before we get into the other thing I wanted to cover, but I will say that Roy Horn of Siegfried and Roy has passed away from COVID-19. He was a part of Siegfried and Roy. They were a Las Vegas act using animals, endangered species usually, to just make them disappear and all that other good stuff. He was, I believe he is the one, if I recall, he is the one who was mauled by a tiger. His argument was that he was having a seizure. The tiger, out of love, chomped him and pulled him off a stage. The animal control said no, the tiger attacked him. But whichever side, whether you're for the tiger or against the tiger, obviously you can't really blame the tiger for being part of a Las Vegas show. Famous German magician duo Roy Horn has died from complications of coronavirus. Little Richard also died. If you don't know who he is, he's worth getting to know and to understand. He has died of bone cancer, so we'll two asides. I will, and yes, we have this in the live chat, and we'll get into that in a second. There is definitely, coronavirus is inside the White House, and since Trump has been adamant about not wearing any kind of protection, I have a hard time he's been exposed to it. The current head of the CDC is now self-isolating himself. The press secretary for Mike Pence and what is called the body man, the personal valet to the president of the United States, has also tested positive. This is body man. This is the human being who's closest to him for the greatest period of time during the day has tested positive. It's possible Trump doesn't have it, but I don't know how. And we'll find out probably in a few days. But there is also reports, and this is a mixed bag once you understand it. There are reports that there is now at least a second strain of coronavirus that is circulating. This strain is more virulent, more contagious, significantly so than the original strain. However, there is some question as to which strain is currently producing the most number of infections, and that it is in fact already that second strain that has caused most of the damage that we are seeing now, and not the first strain. But the problem that this is a very big indicator of is you could get to one strain and not the other. And when we make any kind of vaccine, it will likely be effective only against one and maybe partial efficacy against another. This is why you have to get flu vaccines every single year. It changes. It mutates. COVID-19 we knew was going to mutate, and we now know has mutated into, again, ostensibly a stronger and more virulent, wow, I better learn to pronounce that if I want to keep doing this show, strain. But we are not sure. The evidence seems to strongly suggest that the strain that is causing the most deaths in this country is in fact the second strain, and that the first strain is sort of the one that we kind of knew about and started studying, while the second strain was out there doing most of the damage that we see now. So, yay. September 11th, 2001. 3,000 Americans died in one day. Worst terrorist attack on U.S. soil. Shocked this country. 3,000 Americans in one day. Every year, 36,000 Americans die from gun violence. Every year, 36,000. 100,000 are wounded with a gun. We spend $200 billion every year fighting terrorism. We have a defense budget of $750 billion, more than the defense budget of every other country in the world combined. We have 95% of all of the world's foreign bases owned by the U.S., 750 bases across the planet. Owned by us, we pay to maintain. Most of the other countries, of the top 28 countries in the world, 26 of them are allies when it comes to defense spending. The UK, Canada, Japan now. This is where our money's going for the military to fight terrorism. I think fighting terrorism is a good goal. But the FBI started tracking terrorist information in the 70s, 1970s. From 1970 to today, we have averaged 76 Americans killed every year to terrorism. I did not misspeak there. Since the 70s, when the FBI first started recording, including and not limited to September 11th through to today, 76 Americans have died every year from terrorism. That's worldwide. That's like Americans who were in an embassy that got bombed. Worldwide, 72 a year. We're spending $200 billion on terrorism. We've created the single largest bureaucracy. Al-Qaeda had been trying to hit us since the 80s. I mean, Osama bin Laden offered a bounty on any dead American anywhere in the world, and they tried to blow up the transatlantic flights, 12 of them simultaneously. I mean, they were gonna hit us. We could have blocked the airplane doors. We could have made it so you could dump fuel off an airplane. You know, in case it gets hijacked, you hit a button and you got 30 minutes of fuel left. No matter what happens, you got 30 minutes of fuel left. Either you land or it crashes. But that's what happens. There are ways to have dealt with this without creating the single largest bureaucracy. Republicans talk about being for small government. No, they're for big government. They're for military spending. They're for huge bureaucracies that monitor people, believe it or not. And they're for corporations. Why? Because the corporations give them most of the money. That's why they say they're for small businesses. But if you take a look at the last bailout package, it's bailouts for huge corporations and not the ones that employ large numbers of people, I may add. 72 deaths per year to terrorism, 36,000 deaths from gun violence. How many are we looking at from COVID-19? Well, according to a study at Johns Hopkins University, which is questionable, I think it's a reasonable guess. There are other reasonable guesses, like I said, 2,000 to 3,000 deaths. Let's say 3,000 deaths. That is one September 11th every single day. One September 11th every single day until we find a way to stop this. And people want to go outside because the economy, again, we have answers to the economy is fixable. It's doable. It sucks, but it's doable. Nobody's saying it's going to be easy. I thought this, again, greatest country in the world. Why is it the people who say this is the greatest country in the world are the first to want to bail when things get difficult? I'm sorry you can't be a professional consumer anymore. A UBI really would have been really smart. And I know it sounds like socialism, but you know what? This is an emergency situation. He is a wartime president. I will give that to Trump. He's a wartime president. Don't pay the corporations. Pay people. Give them a UBI. Give them something so they can survive at home for the period of time where we could have ended this. We are past that point now. We cannot do that anymore unless we start over, which frankly I think we should. I'm going to go stir crazy. I'm going to go nuts. Anybody who's been at home, for everybody, is going to go nuts. It's better than, oh dear Lord. So, we're going to open up, and credible studies are saying that by June 1st, we will have a 9/11 every single day in this country. I'm concerned that this concerns far too few people. And I talked about the heroes because sometimes doing the right thing is never easy. If it were easy, everybody would do it. It wouldn't be. What was the line? You know, a shortcut has to be the shortcut. If it was easier, it would just be the way. If it were easier to do the right thing, it would just be the thing everybody does, and the right thing would be whatever the next most difficult thing is. If you love this country, if you love the people in this country, if you love the healthcare workers who represent the best of us, nobody becomes a nurse to make money. Nobody. They're the best of us. And more of them will die because we want to get Oreos at the grocery store. So, I don't mean to lecture, and as usual, I've managed to lecture anyway. I think there's been a lot of selfishness, quite frankly, in a lot of people in this country, and I think we have that because we haven't been asked to sacrifice in quite some time. We haven't been asked to sacrifice since World War II. That was the last time we had to invest somehow in our decisions. I'm not necessarily against the notion that in order to vote in this country, you should have spent some time in the military. I think that would dissuade a number of people who find it easy to send other people's children to war. I read Starship Troopers. That wasn't a bad argument in there. I'm not sure I'm on board with it, but I'm not sure I'm against it either. But I think you have to be willing to sacrifice something if you're going to say, too, that you want the benefits of being in this country. We are already seeing an uptick. A number of states have started opening, starting with Florida, Michigan, and I wanted to say Missouri. I think it's Missouri. Michigan is starting to see the increase in COVID fatalities and infections as a result of having had their primaries when they really shouldn't have. No, sorry. With Michigan, it was the protests, which you can see now across the country. In Florida, the beaches have opened, and it's summer. More and more people are going out, and these numbers are going up because there's a 2-week delay between when an action is taken and seeing the effects of that action. If this country shuts down, period, right now, it'll be 2 weeks before the numbers start to go down, before we see the effects of shutting down. If this country opens up completely, it'll be 2 weeks before you see the huge spike that you're going to see as a result. And everybody, I mean, this show predicted, we sat here 2 weeks before the numbers started going up in, especially May 4th, I think. Let me just double check. May 4th, the numbers started going up significantly. Again, they're going up again. We were beating this thing, and we just said, well, oh, wow, we're about 70% down towards the finish line. Let's just give up. Numbers are going back up again. They're going back up in each state 2 weeks after as these things open. States next week are starting to open in earnest. And 2 weeks from then, this country is going to start to get a second lesson in exponential growth. Every 3 days, enough rice or wheat, depending on the story. 1 on the first square, 2 on the next square, 4 on the next square. Enough to bury half the state of Missouri in rice. That's exponential growth. That's what we're going to see, and that's why the numbers are going to go up so quickly. 1.6 thousand people died yesterday in the United States of coronavirus. And the estimates are we could be at 3,000 by June 1st. Russia, which had successfully contained the virus, has now seen a massive spike. Ostensibly, 2 members of their parliament were on vacation and got it. 2. Got it while on vacation. They are seeing a huge spike and now seeing 10,000 brand new cases every day. Started with 2 in their parliament. This is why we talk about exponential growth and the problems here. When it started in this country, it started on the coast, east coast and west coast, primarily because those are where the biggest airports are and the largest population centers. It headed in a lot of the Midwestern states, which are the ones who are most saying, hey, this isn't a big deal, because they haven't seen it yet. Dallas hasn't turned into New York yet. Now it will. There's basically no stopping it. It's gravity. It's a certainty. There's not. I'm sorry, we just know this. But now, as we open up, and Dr. Seigart had mentioned this earlier, instead of a few cases coming to the U.S. and it working its way in, there are cases in every country. There's a state. There's a lot of cases in every state, and as people go out, all of these simultaneously will start to infect everyone. So the 3,000, I think, is the highest estimate that there's been. I hope it is, in fact, the highest there is, but these estimates keep getting changed, and they keep getting projected upwards. The White House, which had said originally only 64,000 deaths, we've passed that. We're going to hit 100,000 deaths probably before the end of May, and they are projecting as many as 250,000 deaths in the U.S., and that projection is going to change because I'll tell you, that's the low end. This is what we tell our constituents so we don't freak them out projection. All the other projections are it's going to be more. And reasonably quickly. This isn't over the period of a year. This isn't 72 deaths to terrorism a year. And again, if you don't believe that number, look it up. It's the FBI website, 72 deaths. 72 deaths in America to terrorism every year. But we can't deal with COVID and we're not going to bother trying. In New York, the number of COVID deaths has dropped significantly, but is still in excess of all of the other deaths or causes of death in New York combined. They are seeing a number of children getting these rashes and also what appears to be toxic shock. So that has not been calculated into the current mortality figures, nor has other deaths such as what we talked about earlier, the embolisms, and a few other complications. It also doesn't take into account permanent kidney and lung damage and possibly even brain damage that is being found now in some people who have had this. So this is not a joke. This is why the former CDC director, when he was testifying, said that this is going to get much worse, and we don't know how bad these numbers are. And the mortality, oh, I'm sorry, lost my train of thought there. This is going to get worse. Yeah, he said it's going to get a lot worse. And I wish I could say it wasn't. That's, I don't think, realistic. Oh, yes, what he had said that I was looking for, clamoring for, was that this was worse than the Spanish flu. The Spanish flu was the single worst, up to then, pandemic. Struck the U.S. We talked about it before. We talked about Denver reopening before and what it cost Denver. This country did. We learn history, so we don't have to repeat it. This is what happened during that pandemic. This country knew back then, 100 years ago, how to deal with it. This country locked down 100 years ago. Businesses wanted to reopen early, bowing to political pressure. 100 years ago, we did, and made that virus 100 times worse. The second wave was 100 times worse. Maybe hyperbole. I forget what the precise number was. It was more than 10 times, somewhere between 10 and 100 times. It was, yeah, I think it was about 100 times worse. Somebody in the live chat will have it. It was bad, that second wave. We haven't even finished the first wave. We're going to catch up. There are very real things that you can do to prevent this. Stay home. You have to go. Wear a mask. If you see people not wearing masks, don't get in their face. Don't sit there and start a fight with them. But if you know people who think this isn't a big deal, talk to them and say, yeah, it really is. And this is why. And these are the people that are getting hurt, including children. Because I've seen the argument that, well, it's mostly old people dying, and so it's okay. Not your kid that's getting toxic shock now, is it? So, the former head of the CDC said that the best single weapon we've got is information. Even if the states open up. I'm telling you, I'm saying, I hope you'll listen. Stay home. Stay home as much as you possibly can. And be ready for this to get worse. Because it will. That's not a guess. It will. Every doctor, everywhere that I've heard of, every epidemiologist, they're all saying it's going to get worse. Because information is so important. That's why we have to say this. Remdesivir is a great reason for cautious optimism. And if that really works, and if we can ramp up production, we're going to be a lot closer to the end of the tunnel on this, to the light at the end of the tunnel, than we think we are. But we don't know, and we can't bank on it. We've banked on it before, and we've been wrong. So stay home. Take care of your families. Take care of each other. Take care of yourselves. This is a moment for everyone to come together as a planet. It was recognized as such when the UN proposed a resolution declaring a ceasefire worldwide, an end to all fighting everywhere on the planet. That's never been proposed, ever. At the direction of the White House, the U.S. vetoed this resolution on the grounds that it mentioned the World Health Organization, an organization that Donald Trump has pulled the funding for on the grounds that he blames them for trusting China, which they never did. He did. These are facts. He went out saying China's giving us all this great data. The World Health Organization's like, well, they're telling us these things. We don't know if we believe any of it, but this is what they say. We have pulled our funding for the World Health Organization, making up most of its budget. And because they were mentioned in a resolution calling for an end to all violence across the planet, we vetoed it at the direction of this White House, at the direction of your president, who some of you probably voted for. This was political expediency. And as I said at the beginning of this show, we always find ways to make our heroes become part of the political process. That's okay. Both sides do that. Dems love to do that as much as anybody. Here's Neil Armstrong. He's with me on stage. Vote for me because he supports me. Everybody does this. I get that. I really do. But if you really care about American heroes and you want to see what's best for the people who are the best of us, the people on the front lines of any war, today it's doctors and nurses. Stay at home. Help save their lives. Help save their lives by making it so that they don't have to work so much that they start thinking about suicide. That's what you can do. And it is its own little act of heroism, because you are being asked to sacrifice. Do that. And between us and them, maybe it'll be enough. Until then, let's hope our president decides to start turning some things around. My name is Nicholas Lamar Soutter. This has been In Time.